Never mind. So we are hoping that the juvenile and the senior gynecologist will give you some food for thought. We're going to cover postpartum rejuvenation. I guess it is like something all of us have come across, and we've been, wanting to do something, and the least we have done for our postpartum women. We are mostly focused in the antenatal period. We do this and that with her, and just, let her be in the postnatal period. That is what we should not. Yes, ma'am.
Pregnancy, here sitting gynecologist, everybody well versed with the changes in the pregnancy and delivery. They are happening. They are anatomical, physiological, hormonal, emotional, financial, lots of burden, and that too is comparatively minimum time duration. And these changes, some changes are reversible, some changes are permanent, and some changes revert back in within 24 hours, 48 hours, within 1 week, or 3 weeks, 4 weeks, or 3 to 6 weeks. And some changes, they are not desirable at all, but some changes we can wait for the health status of the patient and the baby, newborn baby, and but some changes we cannot wait, and some changes and some cosmetic can be done then and there only. So just starting from the very beginning, I want to ask, what are the changes women are worried about after delivery? From Dr. Chandan.
Hello. Hi. So immediately postpartum, patient can have acute problems and some chronic problems. So acute, we are not very, I think this time not very important, like bleeding, infections and all. And chronic problems, they can have lax vagina, widened introitus, muscle, abdominal core muscle weakness. Then mostly we see the urinary incontinence sometimes. Aesthetically, definitely they have stretch marks. Stretch marks actually start from beginning only, antenatal only. They will eat your head, why? They give us something for that. Skin pigmentations, loose skin, episiotomy scars and episiotomy problem, but tears may be there, and that may cause problem. And very late, again, vaginal laxity and stretch marks and skin laxity might be there. And mostly we see these problems, lingering on one after the other. Every time they come to you, they will be, complaining of these problems.
So since you are practicing purely obs gynae, Dr. Chandan, so how frequent do patients come with this?
Very much. I mean, with different problems, they will come at different stages of life. Immediately, they will tell you that pregnancy ke baad, even the sexual problems are there. They don't enjoy it so much, and they are having dryness later on, and with even mental problems. Mentally they might have vaginismus later on after the baby is born for some time. So they need your help for all these problems.
Yes, Dr. Manisha, would you like to advise at what time patient should start exercising or physiotherapy? Although we can start from the before conception also, and during conception or after conception. What are your viewpoint about this?
Ma'am, physio, we start definitely postpartum, immediately post-delivery. But we start with very basic exercises, like maybe, asking them to start activation, engaging your core muscles, back muscles, pelvic floor muscles. Basic mobility is what we look at, posture correction, because the initial phase, 6 weeks, is all about more focus on breastfeeding, ma'am. And they don't look at the aesthetic part then. So that's when we talk about, post 6 to 8 weeks is when we ask them based on their mode of delivery. If it's a section or a vaginal delivery, we ask 6 to 8 weeks. They can get back and start with the postpartum fitness exercises.
Okay. Yes, very true, very nicely explained. But I will say, even during pregnancy, pelvic floor exercises and some stretching exercise we should do before delivery, also during pregnancy, so the result is comparatively better. And one more thing I will like to mention here: if all the things like weight gain is normal, then the things to come back to the normal is very easy comparatively. So we have to assure in the pregnancy only to the patients that weight gain and exercise and toning of the muscles should be done in pregnancy and should be normal, within normal limits, not over weight gain or weight gain. So the things will going back to your body shape and all will be very difficult.
So, Dr. Manisha, just tell us little about the postnatal physiotherapy. Just elaborate a little on that.
Sure. Ma'am, postnatal physiotherapy, initially, like we said, the first 6 weeks is only about the basic range of motion and activation. Posture correction is what we look at. Post 6 to 8 weeks, we first thing start with an evaluation of the diastasis, like that, the abdominal muscles, and the evaluation of the pelvic floor muscle because they are correlated. A diastasis recti can also cause a weakness in the pelvic floor muscles. So we start with basic activation of the muscles. We can also, based on severity in the weakness in the muscles that is there, whether for the pelvic floor or so, we can start with biofeedback training or the Kegel exercise trainer. You have electrical muscle stimulation under the electrotherapy part. Exercises, it's pure on strengthening, because both of them are correlated, so you need to ensure that there is back strengthening, core strengthening,
Yes.
and the pelvic
Pelvic.
strengthening.
Right.
Absolutely fine.
Perennial tears.
Now coming to the immediate part, after physiotherapy, the physiotherapy is a root cause, is the main part of the coming back to the normal. And perineal tear, I want to ask Dr. Ashok and Dr. Chandan, is there, like these days we are saying episiotomy should not be given to have the better cosmetic result, but at the same time the chances of tear are there, or midline episiotomy should be considered, or light tear are better cosmetically, better like painless or less pain or better healing, or mediolateral episiotomy. What is your viewpoint?
Good afternoon and thank you very much. Perennial tear, actually, see, these are as a result of perennial insult which occur at the time of childbirth. This insult may be visible or not visible, because 9.5 centimeter fetal head, if it is going to deliver, there ought to be some changes. Now these perennial tear or these insult or trauma depends on the duration for which this distension stays there. If it can lead to reversible or irreversible changes. So there is a need for, as we have discussed just now, about the physiotherapy or the exercise which has to start from the antenatal period, and we at our Dr. RML hospital, we have started this campaign of antenatal physiotherapy exercises, and we counsel the pregnant ladies about this, and we give them the demonstration, and they do in the hospital also. And then it has to be continued in the postpartum period. So if from the antenatal period they are taught about the pelvic relaxation or yoga or something like that, where the perineal muscles are being taught to be relaxed during vaginal delivery, then probably the insult will be less. But it ought to be there. Sometime it is minor, sometime it is major. So that is the process. And the tear are, if your conduction of the vaginal delivery is not proper, then probably more tear will occur and more insult to the perineal muscle as well as to the anal sphincter or anal part also. So that we have to take care. The second, what about what you have asked about the episiotomy part? See, now the shift is towards the selective episiotomy. Now people are not following the routine episiotomy, because they say if you take care of the conduction of the vaginal delivery in a proper manner, probably episiotomy is not indicated in all cases. So you need to be careful in which cases, if you expect or anticipate some difficult delivery, or perineum is tight, or there is a suspicion that this perineum is going to be having too much injuries, then you give episiotomy in selected cases. So selective episiotomy is the concept now coming up. The third part which is there is what type of episiotomy. See, in a standard teaching, we have learned that midline episiotomy is dangerous. If you are not careful enough, it will extend toward the rectum and it may lead to the complete perineal tear or rectal injuries. So always we have learned that it has to be mediolateral episiotomy, which is safer. So by practice point of view, I think we have to follow mediolateral. And now there is a discussion on the angle at which or at what degree you have to give it. Now they were saying earlier we have read 45, now they are shifting towards 60 degree also. So these are the changes and these are the modifications that have been done to decrease the incidence of perineal tears. But we have to keep in mind these perineal tears are one thing, but you know perineal lacerations are more which are not visible sometimes, or sometimes you see the laceration in the periurethral area or in the inside the labia majora also. So always be careful about the difficult vaginal delivery, and if it is anticipated, try to give episiotomy.
To find out butthole tears of rectum after complicated delivery, and we must learn how to identify external sphincters and internal sphincters, because that is the best time to repair them. Once we miss them, patient will definitely have incontinence, fecal incontinence sometime in her life.
Yes, very good. Any tips you want to give, Dr. Chandan,
Can I
while
just add
suturing?
a sentence? We recently had a RCOG workshop in which they said deliveries are best conducted with 2 people, not 1. And also while suturing, 1 person should put the fingers in the rectum, so that the problem is actually the deepest muscle layer, which is very close to the rectum, gets left out. That is what causes the problems.
This is very important to, you know, sometimes we miss the rectal tears. So just to be very sure that we have not done that, we have to do a per-rectal examination. We, in our, while we were studying, we were always told to, you know, 1 person will put the finger there and then you stitch the muscle.
Take a deeper stitch.
Otherwise you can sometimes, you know, injure that is very important. And I think the most important part is assessing your patient individually. Every patient is different. What you can apply on one patient cannot be applied on the other. You have to assess the pelvis, you have to assess how she takes the pain. It is not that a sleeping patient where you are just pushing and then it will cause a lot of tears. So in that patient, we have to give a little bit bigger episiotomy. Maybe the vagina is very tight. So that time also a bigger episiotomy is needed. So every case is individualized. Then only we can minimize the injuries.
Anybody from the house wants to give any tips taking in consideration of cosmetic perineum, like during stitching, and vaginal functioning?
Proper alignment is very important. Yes. That is, of course, goes without saying. And rapid absorbable sutures and subcutaneous skin suturing.
Subcutaneous. As Dr. Ragni exactly told us not to leave episiotomy to the very junior, or like you have to teach them. Sometimes muscles is not stitched properly during episiotomy. Muscle, so perineum was relaxed after that. So we have to take care of stitching the muscle part also.
Dr. Chandni's not there, but we'll ask them. So, any of you can take this question. Your recommendations for cosmetic repair of perineal scars. Do patients come? Post-episiotomy, post-tear repair?
So when a patient comes with a perineal scars and a specifically thickened episiotomy scar, there are 2 or 3 things you can do. One thing is a very, very simple thing. Your needle. Take a sharp needle and put inside behind the scar and move it, just to break all the adhesion point, fibrous point. The moment it becomes loose, it becomes flattened and there is no pain. Second thing what you can do is laser resurfacing and PRP. Even in the patient, if you are doing lots of tear is there and you are doing stitching it, you can apply PRP at the time of the stitching, or when patient comes to you after 7 days. First healing is there, then you can do the PRP in those patients. Specifically, it is a very, very deep episiotomy. So it's these 2 things which I use in my practice.
So, Dr. Chandan, how many patients, since you're working in a corporate hospital? Yes, sir, please. Sorry.
So, very nice point about lasers for these scars. So, usually we have a lot of limitations in aesthetic practice wherein we have to wait at least 3 months post lactation, actually, to be precise with the US FDA guidelines regarding any injectables for the scars or even the micro needling with radio frequency. So, once that period is over, we take the patient into mummy makeover. So, in that, these perineal scars also come into micro needling with radio frequency with a gold tip. So
Yes,
if you
sir.
see Inmode company has the product, what it does, it
Morphus
has 6
V.
to 8 sessions 2 months apart, and you can see reduction depending on the grading of the scar. Six to 8 sessions in within 1 year it goes down by 70 to 80%.
Yes.
Then you can maintain with silicone gels in any form, and cosmetically it can be actually taken care of.
Right, sir. Yes. So, Dr. Chandan, since you're working in a corporate setup, so
What happened, there's a difference you see when we do the carbon dioxide laser, automatically it causes a microablation. And when we talk about the RF, it has to use the micro needling. So basically the both are the same thing. Here with the micro needling we are going to sending the energy inside, and it itself laser is causing a micro channels.
Okay, so answering your question, so we have an India inside India. One sort of patients, one set of patients who are very conscious about episiotomy, normal delivery karani hai, and then they also want good episiotomy scars. But there is an India who is least bothered about it. So most of the patients are not very much bothered about, unless they have some problem like painful intercourse or something like that. Otherwise, cosmetically, definitely a sect of people who are very much bothered about the scars, especially in that area. You see, some time back we were not even waxing that area. Now everybody in the new generation is waxing the private area, which is very, very common these days, and it was unheard of maybe about 15 years back. So definitely patients are getting to know more about treatment for episiotomy.
Dr. Seema, your opinion on this?
I would totally agree with Dr. Chandan. In my practice as well, there are not many people who are worried about the scar per se. They will only come and complain if they are having issues while having sex or they are having pain.
Right.
So per se, I think very seldom, 2-3 patients a year.
Okay. So, Dr. Chandan, the next question is for you. What do you suggest for a postpartum prolapse?
Postpartum prolapse, I think we should start from the antenatal part only. Like Madam said, that antenatal class is for physiotherapy, good exercise before that will make the patient ready for the delivery, and how to take the pains, and when the patient is mentally prepared for delivery, the delivery becomes very easy. So suddenly she is told to push and all, she doesn't know about it, then chances of postpartum prolapse becomes more.
Happens.
So antenatal exercises and counseling definitely, and later on the art of delivering, I think, how do you deliver, and the postpartum care, it should not get infected or something like that.
And even with that, you need a continuous physiotherapy support also during the birth.
During the birth, you
Yes.
have those doula sisters and all, so they really help. They really.
So, Dr. Manisha, you were saying something.
What I wanted to add was, ma'am, the perineal care, like when you talk about, the perineal care, we can start with antenatally also. I'm not sure how many will really agree with it, but there's also a way, I think, where we've had some patients telling to us about perineal massage. That it has worked because then that gives definitely good support. And during the delivery, maybe a perineal support also helps in preventing the tear, which can, eventually lead to any other weakness of the pelvic floor, or then result into, uterine prolapse in the future, or an incontinence issue as well also.
All right.
And not to have difficult vaginal delivery, right? Better to have cesarean.
So, Dr. Seema, role of energy-based devices in prolapse, uterine prolapse, postpartum.
Well, it definitely is helpful in early prolapses. Dr. Ragini mentioned that we should avoid in very higher grades of prolapse, and it doesn't work, especially in patients who have very wide hiatus. EBDs are useless. So surgery remains a gold standard for very big prolapses. So there is a very early phase where, early postpartum phase where you should catch the patients. I normally start telling patients about Kegel's exercises during their antenatal phases and even immediately after their delivery. When they come on day 7 for this thing, that I would say once your stitches are healed, you would come and do this physiotherapy, because I have that Emsella chair with me, and then I make at least my normal delivery patients sit on that, and also offer patients who have stress incontinence to go through the prolaplase.
So, ma'am, just put some light on the chair. The HIFEM chair she's talking about is the Emsella chair. I think most of you have seen at the conferences. So, ma'am, just tell your experience about it.
So it is fantastic in my experience. It does correct early stress incontinences, and we have these patients highlighted in the antenatal phase itself, because a lot of patients who still these days, flu is going on. Patients complain, oh, मेरे को leaking हो रही है खांसी करने से and all that, I'm miserable. So start with Kegel's exercises, and immediately, once she delivers, she continues with Kegel's exercises. So she's got a few months experience, and she knows how much she can improve on that. And beyond that, she needs to do this pelvic physiotherapy. This is a machine where it looks like a chair, where people would sit on the chair, and it's a 30-minute session. I personally I try and tell them you come every alternate day, but they can't, so they probably make it like 2 times in a week.
Yeah.
Ideally, machine and manufacturers say once a week is enough, but practically I feel if you do quick sessions, it is more helpful. And machine manufacturers also say that at least 16 to 17 sessions are important for retaining the actual muscle strength. So we just make them sit. Like my nurses operate on the machine, we have a console wherein you just have to feed in whether she needs muscle strengthening, or she has stress incontinence, she has urge incontinence, or she has a mix, or all those protocols can be selected. She sits there, machine does create a magnetic field. It is up to 3 Tesla, and this causes muscle contraction, and it says that a 30-minute session on the chair is equivalent to 10,000 Kegel's exercises. So that is how it helps, and in my practice I have felt significant improvement in stress incontinences.
Right. So, Dr. Rajesh, since you were talking about microneedling with RF, so I believe you're talking about Morpheus V, right?
Name of the chair, there are many companies
Yeah.
available. Lot of people are aware of Emsella. I have Escara, which has now been taken over by Photona, because I have a Photona laser, and I've been working on this laser for the past 5 years. When I got it, it was for 12 lakhs. I think now it's gone up quite a bit.
Quite a bit.
Can I add to that point?
Sure, sir.
Ma'am, that's the right thing actually. It's 12,000 Kegels for a 20 to 25 minute session.
Yes.
For the Emsella chair. We have the Star Former Photona. That is the first one in India, and we still are the first one in India. It is the same concept of Kegels. So that is twice a week for 20 to 25 minutes. 12,000 Kegels twice a week is 24,000 Kegels. It's USFDA approved also, not only for the new machine that is there, is not only for stress incontinence, but also for low back pain. If you see, the same machine has 4 magnets. Now in Emsella, the enhanced form of Star Former also has the same machine for low back pain, and the off-label has also come in for the better half for maintenance of early ED.
Right. So I would like to
Now
add.
we are talking about the males also for the ED patients.
Yes.
Yes, yes, ma'am.
Even prostate issues
No,
also.
not for prostate. It increases prostate
not the
issues.
prostate.
It can cause prostatitis actually by increasing the blood supply.
Prostate का नहीं है,
And also we
muscles.
need
They
to make
also
sure
have a
that there is no
thyroid.
magnetic implant anywhere in the body, especially in the pacemaker, and the hip implant should not
Implants.
So she's saying there should be no metal implant in the body, no stents in the heart, any kind of pacemakers. They are all even while sitting on the chair, you have to remove all the metal from the body, that you're wearing your phone, everything you should be off. You can wear your clothes and sit down, but beware of metal and any kind of electronic device with you on the chair.
So I would like to add here, they are talking about HIFEM chair. That is the modality which we are talking here. So the machine I have, we have an internal EMS for the same purpose, right? So pelvic floor, pelvic muscles strengthening, we use an internal device. I'll be showing in the last workshop of the energy-based devices. So in that, what happens is it's a small probe. We insert in the vagina, and then it is, sending out the impulses. So it causes contractions of the muscles, pelvic muscles. So again, as sir said, that about 12,000 to 15,000 Kegels. So that is solved in a 15-minute session. So that is the beauty of the devices, and they make your work faster. Probably if you've encountered, whenever you counsel a patient in the OPD for Kegels, how many people can, if anybody can just tell me what is the right way to advise for Kegels and how many patients are compliant to it? It's barely.
And how many times?
Yeah, because you actually, doing Kegels for like maybe 5, 10 sittings is not going to work. So you actually need those many sittings, and then the muscles are going to be contracted and coming back to the normal. So Dr. Rajesh, I was asking you, probably you were talking about microneedling with RF. So I think it's Morpheus V you're talking about, right? So what's your opinion, and have you used in
Morpheus V
prolapse?
For the vagina, we also have the Morpheus normal microneedling.
Yes, sir.
That's for the face 1
Yeah,
to
yeah.
3 mm.
Morpheus
We
8.
can use that 1 mm and 2 mm for the perineal area, but you cannot do 3 mm there. It's too
Right,
deep.
sir. Yes.
Second thing is the end point is erythema and redness, and probably 2 or 3 passes are enough. And you require 6 to 8 sessions for 70 to 80% reduction in the scar depending on the severity of the scar.
Right, sir. So we'll move on. Okay. So vaginal rejuvenation postpartum is, what we think of when we talk about rejuvenation. So let's have the expert's opinion here.
So,
That's okay, Rajesh sir.
So we have the Forma V also, we have the radio frequency and microneedling, both formats available for vaginal rejuvenation. It depends whether which kind of rejuvenation is required. If you want complete resurfacing, we have a CO2 also for that. No doubt, madam was talking about CO2, that is the gold standard as a oldest model.
Oldest model, right.
So otherwise, right now what we do is microneedling is an absolutely amazing thing. Apart from that, the patient doesn't want a downtime because these things usually cause a lot of pain.
But Morpheus V is not causing any pain. I'm using it very, very frequently.
Tenderness is there for 2 to 3 days, but if you use the Exilis one, the other one that is the Forma V, if you try that, that's pure radio frequency. And now there's a machine known as Reveal, the diode Reveal you must have heard. We have that machine
Lyra.
also. That is an absolute lunchtime procedure. It is the most affordable treatment that is possible for the patient, and patient can go straight to work from there.
Right. Dr. Seema, what's you have a Photona.
I have a Photona Erbium, yes. But I still feel pelvic physiotherapy started in time works best. And then if at all a patient has collagen issues, she's got wrinkly face and she also has a wrinkly vagina, then you can ask for early prolapse treatment with Erbium as well.
So what I would like to add on, as per my experiences, like if I have a patient who has had multiple vaginal births, so then I have done Morpheus V for her, and it's given me wonderful results. I mean, you would not believe, when the patient came to me, she was 3 vaginal deliveries, and it was like the fist loose. That loose was the vagina. We gave her sittings, like 1 sitting every month, and after 5 sittings, it had become so tight that it was difficult for my TV probe to enter. That was like the change. So it's an amazing, modality, but only once you try and see the results, that is when you actually start believing.
So when you use the Morpheus V, you should also combine that with the diode. So figure of 8. So 5 minutes on each labia if you do it from outside, 5 minutes of 8, figure of 8.
Right.
You will see amazing results in combination with Morpheus V.
So I'm doing Forma V with Morpheus V.
You add diode to that, you will see absolutely amazing results.
Right, sir. Yes.
So ma'am, can I add to her question?
Yes, sir.
So we have a combination therapy, a lovely treatment, Morpheus V, I totally agree. Option is CO2, option is diode, option is Forma. But what you said is a practical thing. It's known as a mummy makeover. 1 year postpartum, 3 months post lactation, we do a G spot, O spot with the PRP and the sensitive area. Absolutely amazing results.
So we also do it with every Morpheus setting.
So what we do, other option is you do below the clitoris and on the most sensitive area in the vagina too. And
the
third
G-spot.
part is you can even do a filler to sensitize that most sensitive area, but you have to be very
Very
careful,
careful with
not to cause bleeding. But the results are absolutely amazing with the PRP combination.
Yes. So as you know, Neena Gupta has, I think, taught all of us that sexual compatibility is equally important, and it's not just the man, both the couple has to be on the same page, and only then the relationship is going to go forward. So let's have Sir's opinion on surgical labiaplasty, sir.
I'm not into surgical.
Not into surgical?
Not into
So Dr. Agni, would you want it? Okay, so we will take this question later. So urinary incontinence, yes, Rajesh sir. We'll start with you.
So I have a lecture now on
Yes.
urinary. If I tell you everything about it right now, from stress, urinary urge, as well as OAB, NDO, a lot of things about the interstitial, a lot of things to talk about. So
And I think we've covered about the energy-based devices already. Okay. So we've already covered this.
So one point I wanted
Yeah.
to say, this was my experience as a case study. What she said is, when we do as rightly said by her, regarding the CO2, the other modalities, the Morpheus V and all that, believe me, the problem is not only with the wife who has undergone the delivery and postpartum for 1 or 2 years. You should also applaud the husband who has been supportive. And what we do is, when she does the package, we make him sit on the star photona chair for his ED, because गाड़ी 2 साल बंद थी, तो इसके लिए he also has to get some feel good. It's more of a feel good product.
Yeah, that he's also being looked after.
Like she said, maybe the CO2 might make us feel good and that make you, but let's do that with the husband also.
And we all believe, I think we have more women in the house, so they believe men are more attention seekers, you know.
Yeah.
So
Provided
agreed, sir. So we should actually counsel the partner also and make him also feel good, not just focusing on our new mothers. Absolutely.
His pelvic floor, I'll tell you, if you see most of the problems of the female, they face is half of them is because of the husband. Because with age, if you see, the husband also has laxity of the pelvic floor. And believe me, that laxity has a lot of problems with their compatibility. So every time when we treat a woman, somewhere or the other, we miss out on that gap of treating the male as well as a scientific pelvic floor rejuvenation for him as well. Otherwise, it won't work.
It won't work. And sir, we practice infertility. So, you know, there are a lot of patients who come to us. They've had a previous child and now they have, you know, sexual dysfunctions. And not just from the female side, it's more from the male side. So as you very rightly said, the counseling has to be done both ways for the couple to actually, you know, cohabit together.
Because a gynecologist is not only for the wife, it's for the husband also, because let me tell you, scientifically, he doesn't know his wife. Hormonally, he doesn't know his wife. He might know him for 20 years, but hormonally and scientifically, you have to communicate in the layman's language to the husband.
Right. Right, sir. So coming to stretch marks, Dr. Chandni, this is for you, totally. So shoot. Tell us about postpartum women who come with stretch marks. So what all are the modalities you do? What is your treatment choice and what do you tell them? And how much is the stretch mark reduction? I guess everybody wants to know.
So primarily stretch marks treatment starts during the pregnancy only. It's not about postpartum. We start the treatment during the pregnancy by prescribing creams and oils. But honestly, we have not seen much results with the cream and oils. So we start the oils, like there are a few famous brands called Bio Oil, which is available and widely prescribed by most of the gynecologists and dermatologists also. So by the end of the pregnancy, if the skin has lost the elasticity, the stretch marks has to increase. And we all know that it is the role of elastin fibers, you know, they are usually perpendicular and then they become parallel to the dermoepidermal junction, and that's why the stretch marks develop. Looking at the treatment modalities, we usually, what treatment I prefer is the plasma plexer pen therapy, which is a newer modality which is introduced recently. It is a sublimation process where, you know, the upper layer of the skin, they usually, you know, they change from solid state directly to the gaseous state. So wherein the results are usually 40 to 50%. 100% results with stretch marks I have not seen. Other modalities are CO2 laser, erbium YAG, glass laser. all these gave only 40% result. I've not seen much of the results in the stretch marks till now.
So do you use disposable plasma pen or do you use that?
I have a permanent plexer plasma pen,
Okay.
which works in a linear fashion. So
Right.
once we start treating the stretch marks, we target single stretch marks and give dotted appearance on the
Right.
stretch marks, and we choose a target area, a proper small area, which we treat at one session.
Yes.
And then we take the other session, we take the different area.
Some people are
like
quite
that.
happy with carboxy for.
Yes, ma'am.
stretch.
I have used carboxy and
Carboxy is a
Yeah.
age-old,
yes,
you know,
but it's very
running
simple
years.
to do and patients actually are very happy about it.
So you can use the post part 1 year post delivery, 6 months post lactation. You can start depending on the degree of the stretch marks, basically striae, gravidarum, albicans. The most difficult are the albicans. So,
Albicans.
so what happens is in these, and even when they do weight loss, you will also see the weight loss marks with that.
Yes,
So
sir.
what you have to do is Dermapen 4 is doing extremely well. 6 sessions. Even the Morpheus is doing extremely
Morpheus is
well.
doing very well.
Absolutely. The results are 70 to 80%. Not only for the scars, it also firms your lower abdomen and the stubborn fat which has developed. And in fact, you can also use it for, if it's a CS, if it's a LSCS, you
Correct.
can use it there as well. So it's a multi-purpose thing, and it's absolutely, I think,
Yes, sir.
Madam will agree to that.
Yeah, so I'll tell you my experience on this. Probably I'm the only one who's using it here, RF. So I do micro needling with RF. It's called as Morpheus 8. That's a handpiece I have. So I use it not just for stretch marks, for skin tightening also, for fat debulking also. So post cesarean, you have the lower tummy, you have a lot of fat because they're not probably, getting into the physiotherapy zone that sooner as compared to a vaginal delivery woman. So in those patients, when you go deeper, you choose a deeper depth with Morpheus, so you can actually do fat debulking also. And
5
simultaneously,
5
skin, yes sir, 5
6
mm.
mm is the highest that we
Yeah.
use with RF. So we can also use for labia lifting.
Yes,
we can
sir.
use it for love handles. We can use for lower back fat.
Yeah,
rejuvenation.
bra fat, bra pads.
Absolutely. And
Yes, sir.
bikini fat also.
Yes, sir.
And nowadays we also use it for breast lift.
Yes sir, so breast lifts, I use threads and I'm very happy with that.
Try the Morpheus 5 mm, you'll love it.
Sure, sir. Okay, so quickly coming to, as sir just mentioned, about the saggy abdomen. So as we've said, we can do, Dr. Chandni, you want to add something for these patients?
For the saggy abdomen, we are usually doing tummy tuck. And
Tummy
also
tuck.
with the threads.
Threads.
Threads has got wonderful results. Cogged
So you're
threads are
using
giving
fishbone,
wonderful
cogged?
results. Yes, fishbone, yes.
You can try the HIFU also sometimes for rejuvenation, high intensity focus ultrasound for
Yes.
contouring. And nowadays there is a new concept in Altera, that is the micro-focused ultrasound with visualization.
Yes,
we
sir.
are using it for smaller areas, focal areas, for severe laxity, for new collagen regeneration through this technology.
Right. So,
How much
Dr.
do you
Manish,
charge for stretch marks? For just
how much do
One
we charge?
session. So
Commercial
it depends on which modality you're using.
So
For the
your
micro-
modality.
Plasma
They
My
wanted to know.
modality for the plasma, we are charging 25,000 per session.
how many sessions a person would need
Four
considering their
sessions at least.
four
Four
for
sessions.
so many
Four
stretch
sessions.
marks?
Really. Sorry, ma'am?
Area.
Uh,
Like
ma'am,
for the
usually
abdomen, for
the
buttocks,
we choose
thighs.
one area at one time. The sessions are usually more. It's basically the entire abdomen will take 4 sessions, but it will be multiple sessions for different areas. So for one whole session of abdomen is 25,000.
So, yes, Dr. Manisha. Yeah, Dr. Seema, you were saying something. Hanji. So, Dr. Manisha, tell us about.
Somebody was talking about bio oils. Somehow we are not very,
No.
proponents
Really, I
of
mean,
bio oils
anybody in the
because it
house has
contains-
seen any difference with bio oil?
Bio oils, I don't think so. How many of you are using bio oils?
You're using?
Recommending bio oils?
Not
We are
working.
Any moisturizer will do the same thing.
Yeah.
Because it contains so many chemicals, so we are not giving
Yes, Meenakshi
antenatal to anybody. Bio oil?
No, ma'am.
No.
I am not.
That's what I was asking. No gynecologist gives. No, I suppose.
Any moisturizer will do the same thing, whatever bio oil is doing.
I use for myself my coconut oil, so that worked for me.
It
is not FDA approved also.
Right.
Bio oil should not be.
So there's one machine known as the Evolvex from InMode. So there are three probes in that. So one is the Transform, that is for fat reduction by apoptosis and muscle building. Other one is Pure Tone for muscle building.
Yeah, I have
and
Tone.
Other is we have I also have.
Yeah.
So when you talked about muscle
Abdominal
strengthening,
core muscles,
it's
yes.
once a week for 10 weeks, then a break of 2 months, then once a week for 10 weeks. If the dietitian is following up well with the
Yes.
patient, then we do it. If they are not compliant with the dietitian and lifestyle, we don't give it. But
We don't give it.
we have seen abs come up for disciplined patients.
Yes.
For women, it's absolutely important because they need to build up their confidence as well.
So I'll tell you, not just postpartum, I have a
Yes.
woman who's a model, and she is coming to me for abdominal core muscle strengthening. And trust me, she actually needs those biscuits here because she wants to wear a crop top.
We are given
And
not only for the abs,
wonderful.
even for the arms. We
Yes,
do it for
the
arms.
biceps area.
Yeah,
Yes.
and the thighs. So we
Thighs.
do the upper and the lower thighs for the butt lift.
Right, sir. Yeah, so we're almost over. Yeah. So, Dr. Manisha, quickly, you've already told. Anything else you want to add?
Ma'am, overall, what also we need to
Dr.
do apart from
Chandni,
the
we were waiting
exercises
for you.
is, I think posture correction is something that we need to educate antenatally, because that actually helps from there how the postpartum period goes also.
Right. So, Dr. Chandni, quickly about postpartum hyperpigmentation.
Postpartum hyperpigmentation is melasma. So I am usually doing tranexamic acid mesotherapy for the patients, which works wonders for me. Also, I am using Hollywood Spectra. That is also very, very good. NDAG therapy. Yeah. Q-switch NDAG laser.
That's correct. We do a lot of only Hollywood Spectra. She's right. So that is one of the best treatments after the Q-switch that have given a new revolution in the market today. And it's no downtime. And not only on the face, you can do it on the whole body actually.
Yes.
Detanning.
Yes.
And anything about peels?
Yeah, chemical peeling is also done.
Peeling.
Yeah, glycolic peel, 35% glycolic peel we are doing.
Ma'am, in the workshop, we'll cover all of that.
The Hollywood Spectra, what she's saying, it's an upgraded form of Q-switch laser, which is very near to a sister concern of Pico. So it's more towards the Pico is one of the best technologies in the market today. I'm so sorry, but the stall is there. If we would have understood, we would have asked them to give you all a demo as well.